पर आपको ध्यान लगाना पड़ेगा क्योंकि आपके सामने स्क्रीन नहीं है, आपको क्वेश्चन दिखेंगे नहीं, तो यहाँ पैसिव नहीं एक्टिव रिकॉल होगा आपका, क्योंकि आपको दिमाग लगाना पड़ेगा। मैं जो बोलूँगा आपको सोचना पड़ेगा क्या बोला है, क्या आंसर हो सकता है, क्योंकि अब जब हम आंसर्स करते हैं सॉल्व तो बहुत से क्वेश्चन ऐसे होते हैं सेम दिखता है टिक, तो यहाँ पर ऐसा नहीं होगा। तो आपको भागना नहीं है, यहाँ रुक कर ध्यान लगा कर क्वेश्चन सुनना है, फिर आंसर कमेंट करना है। तो स्टार्ट करते हैं। तो 50 क्वेश्चन करते हैं यहाँ पर ईएनटी के, जो कि नोज और पैरानेजल साइनस से रिलेटेड होंगे। तो चलिए स्टार्ट करते हैं बिना टाइम वेस्ट किए। सो लेट गो स्टार्ट। सो फर्स्ट क्वेश्चन, a post-COVID patient who is a non-diabetic develops one-sided facial swelling, headache, nasal or sinus congestion, and black lesions on nasal bridge or upper inside of mouth that quickly become more severe. Which investigation would you do confirm the diagnosis of this patient? Option A, X-ray. Option B, biopsy with histological examination. Option C, serum ferritin. ऑप्शन डी HbA1c। तो जल्दी से कमेंट करिए फटाफट। तो आपको क्या लगता है, फटाफट कमेंट करिए। सो इसका राइट आंसर है बायोप्सी विद हिस्टोपैथोलॉजिकल एग्जामिनेशन। तो इसका थोड़ा जो रिलेटेड है वो भी बता देते हैं आपको। तो इसमें जो है द पेशेंट प्रेजेंट विद वन साइडेड फेशियल पेन एंड फीवर विद ब्लैक मास which can be a sign of mucormycosis. Mucormycosis diagnosis can be made with biopsy or resection of the involved area. तो चलिए आप नेक्स्ट क्वेश्चन पर बढ़ते आगे। A patient comes with a history of asthma and sinusitis. On looking into his medical records, you notice this has been attributed to Semter's triad. Which drugs should be avoided in this patient? Option A, कोट्रेक्सामाजोल। ऑप्शन बी, कोएमेक्सोक्लेव। ऑप्शन सी, एस्पिरिन। ऑप्शन डी, क्लोरेफेनिकोल। जल्दी से आंसर बताइए क्या हो सकता है। हिस्ट्री है अस्थमा सिनुसाइटिस की, सेमटेस्टाइड है, इसमें कौन सा ड्रग हमें अवॉइड करना पड़ेगा। ऑप्शन ए कोट्रेक्सामाजोल, ऑप्शन बी कोएमेक्सोक्लेव, ऑप्शन सी एस्पिरिन, ऑप्शन डी क्लोरेफेनिकोल। So right answer is aspirin. The understanding is shown with semtrastide, which comprises asthma, nasal polyps, and aspirin tolerance. Ibuprofen and other non-steroidal anti-inflammatory drugs to be avoided in patients with semtrastide due to potential for serious allergic response such as bronchospasm and anaphylaxis. नेक्स्ट क्वेश्चन पर चलते हैं, थर्ड क्वेश्चन। तो आगे बढ़ते हैं नेक्स्ट क्वेश्चन की ओर। What could be the likely diagnosis for a 60-year-old male who has painless cervical lymphadenopathy, conductive hearing loss, a dull tympanic membrane, and decreased mobility of the soft palate? What could be the likely diagnosis for a 60-year-old male who has painless cervical lymphadenopathy, conductive hearing loss, a dull tympanic membrane, and decreased mobility of the soft palate? Option A, nasopharyngeal carcinoma. Option B, adenoid cystic cancer. Option C, juvenile nasopharyngeal angiofibroma. Option D, Quincy. जल्दी से आंसर बताइए फटाफट। So right answer is nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Chinese has higher genetic susceptibility. In India, it is a common in northern region where people are predominantly of Mongoloid origin. So next question पे बढ़ते हैं आगे। Which fungal infection is frequently observed in the maxillary sinus? Which fungal infection is frequently observed in the maxillary sinus? Option A, blastomycosis. Option B, aspergillosis. Option C, candidiasis. Option D, histoplasmosis. क्वेश्चन दोबारा सुनिए और कमेंट में आंसर फटाफट करते जाइए। Which fungal infection is frequently observed in the maxillary sinus? Option A blastomycosis, option B aspergillus, option C candidiasis, option D histoplasmosis. So right answer is aspergillosis. सो अब आगे बढ़ते हैं नेक्स्ट क्वेश्चन की ओर. सो नेक्स्ट क्वेश्चन है which of the following is the least probable cause of mucormycosis? Which of the following is the least probable cause of mucormycosis? Option A neutropenia, option B broad spectrum antibiotics, option C uncontrolled diabetes without DKA, ऑप्शन डी प्रोलॉन्ग यूज ऑफ स्टीरॉइड. क्वेश्चन दोबारा सुनिए. विच ऑफ द फॉलोइंग इज द लीस्ट प्रोबेबल कॉज ऑफ म्यूकोरमाइकोसिस? ऑप्शन ए न्यूट्रोपेनिया, ऑप्शन बी ब्रॉड स्पेक्ट्रम एंटीबायोटिक्स, ऑप्शन सी अनकंट्रोल्ड डायबिटिक विदाउट डीके, ऑप्शन डी प्रोलॉन्ग यूज ऑफ स्टीरॉइड. जल्दी से कमेंट करिए आंसर फटाफट. तो कौन से प्रोबेबल कॉज है जो लीस्ट कॉज करता है म्यूकोरमाइकोसिस में? जल्दी से. So right answer is broad spectrum antibiotics. Mucormycosis is a rare but serious fungal infection caused by a group of molds called mucosites that are commonly found in environment. Neutropenia, uncontrolled diabetes without decay, and prolonged use of steroid are all risk factors for developing mucormycosis. However, broad-spectrum antibiotics are not directly associated with the development of mucormycosis. चलिए तो नेक्स्ट क्वेश्चन के साथ आगे बढ़ते हैं. A 35-year-old woman takes aspirin of a headache, later presented with wheezing and breathlessness. Along with these two symptoms, what other clinical findings are likely to be found in this condition? क्वेश्चन दोबारा सुनिए और आंसर करिए जल्दी कमेंट में. A 35-year-old woman takes aspirin for a headache, later presented with wheezing and breathlessness. Along with these two symptoms, what other clinical findings are likely to be found in this condition? Option A IgE release, option B nasal polyp, option C extrinsic asthma, option D drug interaction. जल्दी से आंसर करिए जल्दी से. So right answer is nasal polyp. Since asthma, wheezing, and breathlessness and drug interaction aspirin-induced symptoms have already been mentioned, the third component of triad nasal polyp is the correct answer. So आगे बढ़ते हैं नेक्स्ट क्वेश्चन की ओर. A patient has come with one-sided nasal blockage accompanied by watery nasal discharge and bleeding. The diagnosis indicates the presence of an inverted papilloma. Which statement accurately describe this condition? Option A malignant and invasive, option B benign and non-invasive, option C benign and invasive, option D malignant and non-invasive. तो कमेंट करते रहिए जब आपको आंसर आता है तो. So right answer is benign and invasive. Inverted papilloma is a benign sinonasal tumor that has a high rate of recurrence and has the potential to invade surrounding tissue. The tumor grows inward from the lining of nose and sinuses and can invade the underlying bone and surrounding structures. Hence the term inverted. So बढ़ते हैं नेक्स्ट क्वेश्चन की ओर. What is the most likely diagnosis for a patient who presented with a headache and thick nasal discharge, and upon examination shows hypertrophy of the inferior turbinate with a mulberry appearance? Option A atrophic rhinitis, option B common cold, option C hypertrophic rhinitis, option D nasal polyp. तो जल्दी से फटाफट जल्दी से करिए आंसर। What is the most likely diagnosis for a patient who present with a headache and thick nasal discharge and upon examination show hypertrophy of the inferior turbinate with a mulberry appearance? Option A atrophic rhinitis, option B common cold, option C hypertrophic rhinitis, option D nasal polyp. फटाफट फटाफट। So right answer is a hypertrophic rhinitis. Hypertrophic rhinitis is the most likely diagnosis as it characterized by the hypertrophy of the nasal turbinate, leading to symptoms such as nasal congestion, thick discharge, and headaches. The mulberry appearance of the inferior turbinate is a characteristic finding in hypertrophic rhinitis. चलिए तो नेक्स्ट क्वेश्चन की ओर बढ़ते हैं बिना टाइम वेस्ट किए। What test is not used for testing olfaction? What test is not used for testing olfaction? Option A smell, Discats. Option B Arnold stick test. Option C UP sit test. Option D CC sit test. What test is not used for testing olfaction? Option A small Discats. Option B Arnold stick test. Option C UP sit or option D CC sit. So right answer is Arnold stick test. Arnold cuff reflex is an involuntary cuff due to stimulation of the external ear. It is mediated by the auricular branch of the vagus nerve. It is Arnold's nerve. Insert of a cotton bud or touching the external ear activates the nerve and evokes a forcefully cuff. Hence the name Arnold stick. It is not used to assess olfaction. So next question. One liner. फटाफट जल्दी जल्दी बताते जाइए। Which of the subsequent tests is not applicable for evaluating nasal mucociliary clearance? Which of the subsequent tests is not applicable for evaluating nasal mucociliary clearance? Option A, saccharine test. Option B, electron microscopy. Option C, charcoal powder method. Option D, scintigraphy test. फटाफट। So right answer is electron microscopy. Which of the following tests cannot be used to assess nasal mucociliary clearance is a electron microscopy. Electron microscopy cannot be used to assess nasal mucociliary clearance. Electron microscopy can be used to examine the cilia, including that to the respiratory epithelium. So next question की ओर बढ़ते हैं फटाफट आंसर जल्दी जल्दी करते जाइए। During the examination of the female patient's nose, which of the following additional findings may be observed along with nasal obstruction, nasal discharge, and loss of smell? The finding may include foul-smelling discharge and the presence of yellowish-green crust in the nasal cavity. Additionally, the patient is diagnosed with merciful anosmia. Merciful anosmia. So option A, rhomby nasal cavity. Option B, nasal polyp. Option C, inferior turbinate hypertrophy. Option D, foreign body. So right answer is rhomby nasal cavity. सो नेक्स्ट क्वेश्चन की ओर बढ़ते हैं फटाफट आंसर करते जाइए आता है तो आपको। नेक्स्ट क्वेश्चन, what should be the subsequent course of action in managing a patient who arrives at the emergency department with epistaxis despite unsuccessful attempt to stop the bleeding by pinching the nostrils and nasal packing? Option A, ligation of external carotid artery. Option B, ligation of internal carotid artery. Option C, ligation of sphenopalatine artery. Option D, ligation of maxillary artery. फटाफट। अगर नेजल पैकेजिंग के बाद भी ब्लीडिंग हो रही है तो कौन सा नेक्स्ट स्टेप होगा? क्या हम लाइगेशन ऑफ एक्सटर्नल कैविटी आर्टरी करेंगे या लाइगेशन ऑफ इंटरनल कैविटी आर्टरी करेंगे या लाइगेशन ऑफ स्फिनोपैलेटाइन आर्टरी होगा या लाइगेशन ऑफ मैक्सिलरी आर्टरी होगा? सो राइट आंसर इज ligation of sphenopalatine artery. The patient present with epistaxis. There was no relief for pinching. He continued to bleed after nasal packing. Ligation of arteries. Firstly, the sphenopalatine artery is ligated as it called as the artery of epistaxis. सो नेक्स्ट क्वेश्चन के ऊपर चलते हैं, बढ़ते हैं आगे। वन लाइनर है, फटाफट ध्यान देके आंसर करते जाइए फटाफट फटाफट। What is the most frequently reported symptom of nasopharyngeal carcinoma? What is the most frequently reported symptom of nasopharyngeal carcinoma? Option A, nasal obstruction. Option B, epistaxis. Option C, neck node. Option D, anosmia. फटाफट। अगर नेजोफेरिंजियल कार्सिनोमा रिपोर्ट किया गया है तो क्या होगा? नेजल ऑब्स्ट्रक्शन, एपिस्टैक्सिस, नेक नोड, एनोस्मिया। So right answer is neck node. Nasopharyngeal cancer may only present at lymphadenopathy and cervical nodal metastasis. The posterior triangle of the neck has several nodes along the spinal accessory and a cluster of nodes between the angle of mouth and the mastoid. So next question पर बढ़ते आगे। बहुत इजी क्वेश्चन है। एप्स्टीन बार वायरस कॉजेज, एप्स्टीन बार वायरस कॉजेज ऑप्शन ए juvenile nasopharyngeal angiofibroma, option B nasopharyngeal carcinoma, option C Stewart granuloma, option D rhinoscleroma। जल्दी से कमेंट करिए फटाफट, जल्दी फटाफट। एफ्स्टीन बार वायरस कॉजेज। So right answer is nasopharyngeal carcinoma. Epstein-Barr virus is one of the causes of nasopharyngeal carcinoma. The pharyngeal recess or fossa of Rosenmüller is the most typical location of genesis. So next question पे बढ़ते हैं फटाफट। वन लाइनर है। What is the treatment method that is most commonly recommended for a patient diagnosed with nasopharyngeal carcinoma? Option A surgical excision, option B radiotherapy, option C chemotherapy, option D chemoradiotherapy। जल्दी जल्दी फटाफट। What is the treatment method that is mostly commonly recommended for a patient diagnosed with nasopharyngeal carcinoma? Surgical excision, radiotherapy, chemotherapy, chemoradiotherapy। So right answer is chemoradiotherapy. The most preferred treatment modality for a patient with nasopharyngeal carcinoma depends on various factors including the stage of the cancer, the extent of spread, the patient overall health and individual consideration. However, in general, the preferred treatment approach of nasopharyngeal carcinoma is a chemoradiotherapy. Next question. Which ethmoidal air cell are the most constant and largest? Which ethmoidal air cell are the most constant and largest? Option A, agar cell. Option B, bulla ethmodylis. Option C, Heller cell. Option D, onodi cell। फटाफट आंसर कीजिए। Which ethmoidal air cell are the most constant and largest? Option A, agar cell. Option B, bulla ethmodylis. Option C, Heller cell. Option D, onodi cell। फटाफट। So right answer is bulla ethmodylis is the constant and largest ethmoidal air cell. One liner फटाफट। What is the most appropriate investigation to confirm CSF rhinorrhea? बहुत इजी क्वेश्चन है, जल्दी जल्दी बताइए फटाफट। इंपॉर्टेंट और इजी क्वेश्चन है। ऑप्शन ए बीटा टू ट्रांसफेरिंग एनालिसिस, ऑप्शन बी सीटी सिस्टर्नोग्राम, ऑप्शन सी नेजल एंडोस्कोपी, ऑप्शन डी एमआरआई विथ कॉन्ट्रास्ट। व्हाट इज द मोस्ट अप्रोप्रिएट इन्वेस्टिगेशन टू कंफर्म सीएसएफ रिनोरिया? जल्दी से कमेंट करते जाइए। So right answer is beta 2 transferrin analysis is the ideal investigation of choice for confirming CSF rhinorrhea. चलिए तो नेक्स्ट क्वेश्चन में बढ़ते हैं फटाफट। What could be the diagnosis for a 30-year-old woman who was involved in a road traffic accident, did not wear a helmet, experienced a brief loss of consciousness, and later presented to the ENT department with complaints of clear fluid discharge from her nose after 2 days? Option A, allergic rhinitis. Option B, infection due to hemosinus victim of road traffic accident RTA. Option C, CSF rhinorrhea. Option D, post traumatic rhinitis। कमेंट करिए फटाफट। फटाफट. So right answer is CSF rhinorrhea. The most likely diagnosis in this case would be CSF rhinorrhea. CSF rhinorrhea refers to the leakage of cerebrospinal fluid from the nose due to fracture or injury of the skull nose. So next question में बढ़ते हैं. One liner फटाफट. Surgery where one nostril is partially or complete occluded is done for which condition? Surgery where one nostril is partially or complete occluded is done for which condition? Vasomotor rhinitis, atrophic rhinitis, invasive aspergillosis, or option D, allergic rhinitis. So right answer is atrophic rhinitis. Atrophic rhinitis is a chronic inflammatory condition of the nasal mucosa characterized by progressive atrophy, thinning, and degenerative of the nasal lining. Next question, one line of fatafat. X-ray beam angled at 45 degree to the orbitomedial line is also known as. ये क्वेश्चन आपका इस FMG एग्जाम में भी आया था, जनवरी FMG एग्जाम में भी आया था. फटाफट बताइए. X-ray beam angle at 45 degree to the orbitomedial line is also known as option A water view, option B Towns view, option C Laws view, option D Stanवर्स view. So right answer is water view. X-ray beam angle at 45 to the orbitomedial line is called as a water view. Next question, lengthy question, clinical question. फटाफट. What is the recommended course of action for managing a 6-year-old boy who fell from a bed and now has swelling in his nose? Along with breathing difficulties during examination, it was observed that there are smooth, rounded swellings on both sides of the septum. Visible through both nostrils on palpation, the swellings were found to be soft and fluctuant. Option A systemic antibiotics, option B incision and drainage, option C high resolution computerized tomography, option D submucosal resection. फटाफट फटाफट. So right answer is incision and drainage. The case presented here is a nasal septal hematoma. A septal hematoma usually occurs secondary to nasal trauma, and a newly formed hematoma is not always ecomyotic and can only be picked up by palpation. Hematoma feels soft and fluctuant on palpation, in contrast to the deviated nasal septum, which will be firm and concave on the opposite side. Next question, one line of fatafat. Easy question. Which of the following statements accurately describe in Little's area? Option A. Kieselbach's plexus is present in the little area. Option B. It is situated at the posterior inferior part of the nasal septum. Option C. Least common site of epistaxis. Option D. Anastomosis of 7 prior arteries occur here. Fatafat. So right answer is Kieselbach's plexus. Kieselbach's plexus is present in the Little's area. So next क्वेश्चन में बढ़ते हैं. क्लिनिकल क्वेश्चन, ध्यान दीजिए, आराम से सुनिए बैठ के. What is the most likely diagnosis for a 14-year-old male who has been experiencing repeated nosebleed without any history of injury, along with nasal blockage and excessive nasal discharge? During examination, a solid purplish growth is observed on the back of the nasopharynx. Option A nasopharyngeal carcinoma, option B rhabdomyosarcoma, option C pyogenic granuloma, option D juvenile nasopharyngeal angiofibroma. So right answer is juvenile nasopharyngeal angiofibroma is a rare, highly vascular tumor with the posterior nasal cavity found almost exclusively in adolescent boys. So next question पर बढ़ते हैं आगे फटाफट. क्लिनिकल क्वेश्चन, ध्यान से सुनिए. What is the most probable diagnosis for a 35-year-old female patient who is experiencing gradual hearing loss and pulsatile tinnitus in her right ear? Upon examination, a reddish mass is observed behind the eardrum, and an audible bruit is detected over the mastoid during auscultation. Additionally, her Rene test yielded a negative result. Option A CSOM, option B ASOM, option C mastoiditis, option D glomus tumor. तो बताइए फटाफट फटाफट. So right answer is glomus tumor. Glomus tympanicum is a paraganglion of the middle ear which is highly vascular and benign. The common presentation of this tumor are pulsatile tinnitus due to its highly vascular nature and conductive hearing loss due to presence of a mass in the middle ear which impedes the passages of sound waves through the tympanic membrane. Rene test is negative due to hearing loss. चलिए तो नेक्स्ट क्वेश्चन पढ़ते हैं, थोड़ा लेंदी है तो ध्यान से सुनिएगा. What is the probable diagnosis for a person who has facial swelling and orbital edema on the left side of their face after a minor trauma involving a piece of wood 20 days ago? The CT scan showed no abnormalities in the sinuses but revealed subcutaneous nodules. Microscopic examination of tissue sections showed positive for pus stain and ग्रोकॉट्स मिथामिन सिल्वर स्टेन. तो क्या लगता है आपको जल्दी से? ऑप्शन ए फाइकोमाइकोसिस, ऑप्शन बी मिड लाइन लीथल ग्रैनुलोमा, ऑप्शन सी फॉरेन बॉडी ग्रैनुलोमा, ऑप्शन डी IgG4 ग्रैनुलोमा. So right answer is phycomycosis is the right answer. Phycomycosis, also known as a mucormycosis, is a fungal infection caused by mucorales fungi. It is typically affect immunocompromised individual and can manifest as a rhinocerebral pulmonary. So next क्वेश्चन में बढ़ते हैं आगे फटाफट. वन लाइनर, ध्यान से फटाफट जल्दी से आंसर करिए. Which of the following is not considered a major diagnostic criteria for allergic fungal sinusitis? Option A presence of nasal polyps, option B eosinophilic mucin without invasion, option C characteristic CT finding, ऑप्शन डी पॉजिटिव फंगल कल्चर. जल्दी से. और राइट आंसर है इसका प्रेजेंस ऑफ नेजल पॉलिप. Presence of nasal polyp are not considered a major diagnostic criteria for allergic fungal sinusitis. Here an explanation of the option. तो इसमें पूछा था नॉट कंसिडर्ड. नेक्स्ट क्वेश्चन पर सिंपल क्वेश्चन. पॉट्स पफी ट्यूमर इज ऑप्शन ए subperiosteal abscess of frontal lobe, option B subperiosteal abscess of ethmoid bone, option C mucocele of frontal bone, option D mucocele of ethmoid bone. फटाफट. Right answer is subperiosteal abscess of frontal bone. Pors puffy tumor is a rare complication of frontal sinusitis that involves the spread of infection from the frontal sinus to the overlying frontal bone. Pors puffy tumor refers to a subperiosteal abscess. So अब नेक्स्ट क्वेश्चन के ऊपर बढ़ते हैं फटाफट. Next question. In a case of a young adult who has a deformed nose due to a ladder fall, a displaced nasal fracture is observed on the CT scan. When would be the most appropriate timing to perform a reduction of the fracture in this particular patient? Option A within 12 hours following the injury. Option B 5 to 7 days following the injury. Option C after 2 weeks of injury. Option D after 4 weeks of injury. फटाफट क्या लगता है आपको आंसर? So right answer is 5 to 7 days following injury. Next question easy. Bony septal perforation occurs in bony septal perforation occurs in option A, leprosy, option B, rhinosporidiosis, option C, syphilis, option D, tuberculosis. Bony septal perforation occur in leprosy, rhinosporidiosis, syphilis or tuberculosis. फटाफट. So right answer is syphilis. Syphilis is the right answer. What is the preferred diagnostic procedure prior to performing functional endoscopic sinus surgery? Option A, MRI scan. Option B, X-ray. Option C, enteral lavage. Option D, CT scan. What is preferred diagnostic procedure prior to performing functional endoscopic sinus surgery? Option A, MRI scan. Option B, X-ray. Option C, enteral lavage. Option D, CT scan. जल्दी जल्दी बताते जाइए. और राइट आंसर इज CT scan. The gold standard investigation before functional endoscopic sinus surgery is a CT scan of the paranasal sinuses. Next question. What is the most frequent location of obstruction caused by a nasal polyp originating from the maxillary sinus? Option A, inferior meatus. Option B, superior meatus. Option C, middle meatus. Option D, sphenoethmoidal recess. दोबारा क्वेश्चन सुनिए आराम से, कोई जल्दबाजी नहीं है, आराम से क्वेश्चन सुनिए, आंसर दीजिए फटाफट. What is the most frequent location of obstruction caused by a nasal polyp originating from the maxillary sinus? Option A, inferior meatus. Option B, superior meatus. Option C, middle meatus. Option D, sphenoethmoidal recess. फटाफट क्या लगता है आपको? Right answer is middle meatus. The most common site of obstruction of a nasal polyp from the maxillary sinus is the middle meatus. So next question पे बढ़ते हैं. बहुत इजी है. Waters view is used to visualize best which of the following sinuses? Option A, maxillary sinus. Option B, ethmoidal sinus. Option C, frontal sinus. Option D, sphenoid sinus. फटाफट. So right answer is maxillary sinus. The water view X-ray technique is specifically used to visualize the maxillary sinus. So next question. वन लाइनर है, फटाफट फटाफट बताते जाइए, टाइम नहीं है ज़्यादा, टाइम वेस्ट नहीं करना ज़्यादा, जल्दी जल्दी आंसर बताइए. हाउ वुड यू डिस्क्राइब अ फ्रैक्चर ऑफ द नेजल सेप्टम that occurs both vertically and horizontally? Option A, Chivellate and Jargeve fracture. Option B, Sitelli fracture. Option C, tripod fracture. Option D, none of the above. क्वेश्चन दोबारा सुनिए आराम से. How would you describe a fracture of the nasal septum that occurs both vertically and horizontally? Option A, Chivellate and Jargeve fracture. Option B, Sitelli fracture. Option C, tripod fracture. Option D, none of the above. So right answer is Chivellate and Jargeve fracture. A fracture that runs horizontally across the nasal septum is a Jargeve fracture, while one running vertically is known as a Chivellate fracture. So बढ़ते हैं नेक्स्ट क्वेश्चन की ओर. फटाफट फटाफट बढ़ते हैं, फटाफट फटाफट बिना टाइम वेस्ट किए नेक्स्ट क्वेश्चन की ओर. क्वेश्चन बड़ा है, लेंदी है, थोड़ा ध्यान से सुनना आराम से. What is the most appropriate treatment for an older woman with diabetes who received steroids and remdesivir for COVID and is now experiencing a malodorous discharge from her nose along with a black color? Upon examination, it is observed that there is a necrotic mass of blackish color, which is filling the nasal cavity and causing erosion of the septum and hard palate. Option A, aspergillosis. Option B, mucormycosis. Option C, foreign body. Option D, rhinosporidiosis. So right answer is a mucormycosis. Mucormycosis is a fungal infection of the nose and sinuses which may rapidly fatal. Next question. टाइम वेस्ट नहीं करते हैं, फटाफट आगे बढ़ते हैं। सिंपल इजी क्वेश्चन। नेजोफेरिंजियल कॉर्डोमा arises from। नेजोफेरिंजियल कॉर्डोमा arises from। ऑप्शन ए फेरिंजियल बुर्सा, ऑप्शन बी नोटोकॉर्ड, ऑप्शन सी रैपकेस पाउच, ऑप्शन डी लस्कास बुर्सा। ऑप्शन ए फेरिंजियल बुर्सा, ऑप्शन बी नोटोकॉर्ड, ऑप्शन सी रैपकेस पाउच, ऑप्शन डी लस्कास बुर्सा। जल्दी से आंसर। So right answer is notochord. Nasopharyngeal chordoma arise from notochord. So अब बढ़ते हैं नेक्स्ट क्वेश्चन की ओर। A teenager has a mass in his nasopharynx that has minimally spread into the sphenoid sinus with no lateral extension, with no external, with no lateral extension, which could be the probable stage of nasopharyngeal angiofibroma. ऑप्शन ए स्टेज 1A, ऑप्शन बी स्टेज 1B, ऑप्शन सी स्टेज 2A, ऑप्शन डी स्टेज 2B। So right answer is option stage 1B. Nasopharyngeal angiofibroma is a benign but locally aggressive tumor that primarily affect adolescent males. So नेक्स्ट क्वेश्चन की ओर बढ़ते हैं। नेक्स्ट क्वेश्चन इजी है, वन लाइनर है, आराम से सोच समझ के आंसर दीजिएगा। What is the term used to refer to the air cells located at the front of the anterior ethmoidal sinus? What is the term used to refer to the air cells located at the front of the anterior ethmoidal sinus? Option A bulla ethmoidalis, option B Onodi cell, option C Agarnasi, option D Hellar cell। सो एंटीरियर मोस्ट कौन सी होती है सेल? आपको पता होगी, वो होती है निमोनिक भी है आगे, एगार एगार नासी सेल जो है वो एंटीरियर मोस्ट होती है। सो अब बढ़ते हैं नेक्स्ट क्वेश्चन पर, वन लाइनर। विच वन ऑफ द ऑप्शंस बिलो डज नॉट कॉन्स्टिट्यूट a division of the external carotid artery within Kiesel wax plexus? Option A laser palatine artery, option B sphenopalatine artery, option C greater palatine artery, option D septal branch of superior labial. Which one of the options below does not constitute a division of the external carotid artery within Kieselbeck plexus? Option A laser palatine artery, option B sphenopalatine artery, option C greater palatine artery, option D septal branch of superior labile. So right answer is laser palatine artery. Kieselbeck plexus, also known as the little area, is an area of anastomosis or connection between several arteries in the anterior part of the nasal septum. It is a common site of nosebleed or epistaxis. The arteries that contribute to Kieselbeck plexus include a laser palatine artery. They do not directly contribute to plexus. So next question पर बढ़ते हैं आगे फटाफट। प्लीज आई ओके 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 आगे बढ़ते हैं। What is the most probable diagnosis for a 15-year-old male patient who has a nasal mass extending to the cheek, causing one-sided obstruction and occasional nosebleed? What is the most probable diagnosis for a 15-year-old male patient who has a nasal mass extending to the cheek, causing one-sided obstruction and occasional nosebleed? Option A angiofibroma, option B nasal polyps, option C nasopharyngeal carcinoma, option D inverted papilloma. The right answer is angiofibroma. Angiofibroma is a highly vascular benign tumor that commonly occurs in adolescent male and presents with nasal obstruction, epistaxis, and mass extending into the cheeks. बहुत easy question. Next question. What category of malignancy do rodent ulcer belongs to? बहुत easy है. सुनिए ऑप्शन. ऑप्शन ए स्क्वेमस सेल कार्सिनोमा. ऑप्शन बी बेसल सेल कार्सिनोमा. ऑप्शन सी malignant melanoma. Option D adenocarcinoma. So right answer is basal cell carcinoma. Rodent ulcer are another term for basal cell carcinoma, which is the most common type of skin cancer. So next question. In patients with nasopharyngeal carcinoma, in patients with nasopharyngeal carcinoma, what is the primary cause of hearing loss? What is the primary cause of hearing loss? Option A, metastasis to temporal bone. Option B, middle ear infection. Option C, serous otitis media. Option D, infiltration of tumor middle ear. फटाफट बताइए, फटाफट, विदाउट एनी डिस्टर्बेंस. क्वेश्चन सुनिए आराम से, फिर आंसर बताइए. इन पेशेंट्स विद नेजोफेंजियल कार्सिनोमा, what is the primary cause of hearing loss? Option A, metastasis to temporal bone. Option B, middle ear infection. Option C, serous otitis media. Option D, infiltration of tumor middle ear. So right answer is serous otitis media. Serous otitis media. This option is correct, right? So क्यों है सही? Serous otitis media, which refers to the accumulation of fluid in the middle ear, is a common cause of deafness in the patient with nasopharyngeal carcinoma. So next question one liner है, आराम से सुनिए और जवाब दीजिए. What is the most frequently reported symptom in patients with nasopharyngeal carcinoma? Option A, cervical lymphadenopathy. Option B, hearing loss. Option C, airway obstruction. Option D, epistaxis. What is the most frequently reported symptom in patient with nasopharyngeal carcinoma? Option A, cervical lymphadenopathy. Option B, hearing loss. Option C, airway obstruction. Option D, epistaxis. So right answer is cervical lymphadenopathy. The most frequently reported symptom in patient with nasopharyngeal carcinoma is cervical lymphadenopathy. Next question, one liner. What is the most frequently observed symptoms of nasopharyngeal carcinoma? Option A, airway obstruction. Option B, headache. Option C, neck swelling. Option D, epistaxis. Right answer is neck swelling. This is a common symptom of nasopharyngeal carcinoma. The tumor can spread to the lymph node in the neck, leading to swelling and enlargement. So next question. Which of the following is the most likely characteristic of a continuous watery discharge from the nose following a trauma? सुनिए क्वेश्चन आराम से. Which of the following is the most likely characteristics of a continuous watery discharge from the nose following a trauma? Option A, CSF otorrhea. Option B, common colds. Option C, CSF rhinorrhea. Option D, anterior epistaxis. So right answer is CSF rhinorrhea. CSF rhinorrhea occurs when there is a leakage of cerebrospinal fluid from the nose. It can be result of trauma to the head or skull fracture. So next question. Which of the following statements accurately describes a patient who is unable to smell coffee but can smell ammonia after experiencing head trauma? ये बहुत मस्त क्वेश्चन आपके पेपर में हो सकता है, जल्दी से बताइए. ऑप्शन ए, ammonia is used for testing olfactory nerve. Option B, the olfaction system is not damaged. Option C, ammonia irritates trigeminal nerve. Option D, all of the above. So right answer is ammonia irritates trigeminal nerve is the correct answer. Next question, one liner, very easy. At what age frontal sinus appear on X-ray? वेरी इजी निमोनिक है इस क्वेश्चन का वन लाइनर है आपको याद होना चाहिए एट व्हाट एज फ्रंटल साइनस appear on X-ray? Option A 1 year, option B 2 year, option C 3 year, option D 4 year. So right answer is 4 year. What is the most likely diagnosis for a 35-year-old male who present to ear, nose and throat ENT outpatient department with symptoms of a small amount of foul smelling, blood mixed with discharge, accompanied by hearing loss, and a fever that is not returning to normal levels? Option A, meningitis. Option B, lateral sinus thrombophlebitis. Option C, brain abscess. Option D, extradural abscess. फटाफट क्या आंसर होगा जल्दी से? So right answer is lateral sinus thrombophlebitis. लेटरल साइनस थ्रोम्बोफ्लाइटिस का थोड़ा एक्सप्लेनेशन है involves a clotting of blood in the lateral sinus, a vein in the brain that can be a complication of a middle ear infection. The symptom of foul smelling, blood mixed with discharge, hearing loss, and persistent fever align with the localized nature of this condition. So बढ़ते हैं नेक्स्ट क्वेश्चन की ओर. A female homemaker arrives with symptoms of nasal congestion, reduced sense of smell, and a dry discharge from the nose that is greenish and crusty. Upon examination, the nasal passage appears spacious and the turbinate are found to be shriveled. Which surgical procedure would be suitable for this patient? Option A, submucous resection. Option B, Young's operation. Option C, septoplasty. Option D, Vidian neurectomy. तो जल्दी से आंसर बताइए फटाफट. So right answer is Young's operation. Next question, one liner, फटाफट. Rhinolalia clausa occurs in all except. Rhinolalia clausa occurs in all except. ऑप्शन ए, दोबारा सुनिए क्वेश्चन बहुत इजी है. Rhinolalia clausa occurs in all except मतलब किस में नहीं होता आपको वो बताना है. ऑप्शन ए नेजोफेंजियल पॉलिप, ऑप्शन बी नेजोफेंजियल कार्सिनोमा, ऑप्शन सी क्लेफ्ट पैलेट, ऑप्शन डी नेजोफेंजियल एंजियोफाइब्रोमा. So right answer is cleft palate. Rhinolalia clausa refers to abnormal nasal speech due to inadequate closure of the nasal cavity during speech. While cleft palate can cause other speech abnormalities, it is not specifically associated with Rhinolalia clausa. So next question पर बढ़ते हैं आगे. So next question है, what is the likely diagnosis for a 70-year-old man who has neck nodes and exhibits a dull tympanic membrane along with symptoms of deafness and tinnitus in the left ear, and a type B curve on a tympanogram. Option A, chronic suppurative otitis media. Option B, glomus tumor. Option C, nasopharyngeal carcinoma. Option D, senso hearing loss, SNHL. जल्दी से फटाफट दोबारा क्वेश्चन सुनिए, आंसर बताइए फिर. What is the likely diagnosis for a 70-year-old man who has neck nodes and exhibits a dull tympanic membrane along with symptoms of deafness and tinnitus in the left ear and a type B curve on a tympanogram? तो टाइप बी कर्व टिम्पेनोग्राम में किस में दिखता है? ऑप्शन ए क्रॉनिक सुपुरेटिव ओटाइटिस मीडिया, ऑप्शन बी ग्लोमस ट्यूमर, ऑप्शन सी नेजोफेंजल कार्सिनोमा, ऑप्शन डी एसएनएचएल. फटाफट. So right answer is nasopharyngeal carcinoma. Examination of the left ear reveals a dull tympanic membrane deafness and tinnitus. On a tympanogram, a type B curve is obtained. ये सजेस्ट करता है nasopharyngeal carcinoma को. Easy question. Young's operation is done for. Young's operation is done for. Option A, atrophic rhinitis. Young's operation किसके लिए करते हैं? Option A, atrophic rhinitis. Option B, vasomotor rhinitis. Option C, enterocoanal polyp. Option D, allergic rhinitis. So right answer is atrophic rhinitis के लिए यंग्स ऑपरेशन किया जाता है. So next question. In which condition can nucleus cell and Russell bodies are observed? बहुत अच्छा क्वेश्चन है, दोबारा सुनिए. In which conditions can nucleus cell and Russell bodies are observed? Option A, rhinoscleroma. Option B, rhinosporidiosis. Option C, rhinophyma. Option D, rhinitis. बताइए किसमें दिखता है? सो राइट आंसर इज रीनोस्क्लेरोमा में म्यूकुलस सेल एंड रसल बॉडीज दिखती हैं. अगर आपको क्वेश्चन में ये दोनों दिख जाएं तो रीनोस्क्लेरोमा लगा दीजिए आंख बंद करके. नेक्स्ट क्वेश्चन. An elderly diabetic female patient presented with a black foul-smelling discharge from the nose. On examination, a blackish necrotic mass filled the nasal cavity and eroded the septum and hard palate. What is the most probable diagnosis? Option A, aspergillosis. Option B, mucormycosis. Option C, foreign body. Option D, rhinosporidiosis. So right answer is mucormycosis. An elderly female diabetic patient with a black foul-smelling nasal discharge, a black necrotic mass filling with nasal cavity, eroding the septum, and a heart failure is mostly like suffering from mucormycosis. So next question की ओर बढ़ते हैं. A male patient arrived at the outpatient department displaying a saddle nose deformity. He reports a history of cough, intermittent fever, and coughing up blood. During the examination, a hole in the nasal septum is observed along with a pale granuloma. Furthermore, the chest X-ray reveals multiple cavities and the biopsy exhibit granulomas, multinucleated giant cell, and caseous necrosis. What is the most likely cause of this finding? Option A, vaginal granulomatosis. Option B, tuberculosis. Option C, syphilis. Option D, sarcoidosis. फटाफट. Saddle nose. So right answer is tuberculosis. Nasal turbinate Nasal tuberculosis can occur secondary to pulmonary tuberculosis, commonly involve the anterior end of the inferior turbinate and the anterior part of the nasal septum. Chronic inflammation can destroy the nasal septum, resulting in a deformity called saddle nose deformity. It is diagnosed by biopsy, which shows cardiac granulomas, Langerhans, not Langerhans, Langerhans, multinucleated giant cells, or necrotic debris. Next question. A 35-year-old female patient presents with complaints of nasal obstruction and post-nasal drip. There is a past history of FEDSS for failed conservative management 5 years ago. Uncinectomy and maxillary ostium dilation was done during the previous FESS. A DNA done now shows patient ostia and mucosal edema of the maxillary sinus lining. What is the next best step in management? Option A, repeat surgery. Option B, macrolides for 4 months. Option C, steroid irrigation and antihistamines. Option D, biological therapy. So right answer is steroid irrigation and antihistamines. So last question. तो यहाँ पर हमारे जो है अपने क्वेश्चन जो खत्म हो चुके हैं। अगर आपको वीडियो पसंद आई तो प्लीज लाइक शेयर सब्सक्राइब और आप डरिए मत के यहाँ पर आपको स्क्रीन पर नहीं दिख रहा है क्योंकि स्क्रीन पर आपको दिखता है तो आपने वो क्वेश्चन कहीं देखा है तुरंत आंसर लगा देते हैं। यहाँ पर आपको आराम से सुनना है फिर ध्यान लगाना है कि क्या हो सकता है आंसर क्योंकि इससे एक्टिव रिकॉल होगा आपका अंदर ही अंदर क्योंकि आप सोचेंगे कि क्या बोला क्या आंसर हो सकता है ऑप्शन ये है तो आपको आराम से बैठकर कुल 1 घंटे में आपके 50 क्वेश्चन के करीब यहाँ कराए गए हैं। 50 से ज़्यादा या 50 से कम थोड़े बहुत 1-2 नीचे ऊपर। तो आराम से आप उसे सुनिए, बैठ के, लेट के आराम से देखिए, तो आपको अंदाज़ा रहेगा क्या क्वेश्चन है, कैसे सॉल्व करना है, तो आपके लिए बेहतर है। तो आप वीडियो अच्छी लगी हो तो प्लीज़ लाइक, शेयर एंड सब्सक्राइब और लोगों के साथ शेयर कर दीजिए। थैंक यू फॉर वॉचिंग दिस वीडियो और आपके लिए और क्वेश्चन की वीडियो आती रहेंगी। तब तक के लिए आप बने रहिए।